everyone. Hey kids, I'm Buddy. Glad you're here. We're visiting the Children's Clinic. Let's learn about jobs in medicine. Let's go.
Hi, welcome to the Children's Clinic. My name is Sana and I'm the clinic director. At the Children's Clinic, we offer both medical and dental services. Today, we're going to take a look at our medical team and see what they do. We're so glad you're here.
Meet some great people from our medical team.
Hello, I'm Dr. Diane Butterfield. I am the medical director and pediatrician at the Children's Clinic in Oak Park.
What does a pediatrician do?
And a pediatrician takes care of children, so a newborn baby and children your age too. I see all kinds of ages of children. I see them when they're sick, and I see them when they're healthy, so I can keep them healthy and help them out, and I see them when they have problems.
Dr. Diane, how did you become a doctor?
When I was 22, I was lucky enough to visit Kenya. It's in Africa. And I was doing a mission trip there, and I ended up working in a clinic. And before I worked in the clinic, I wasn't that interested in medicine. I always thought maybe I would like to be a lawyer. But once I was working in the clinic, I really, really liked the work. I really like working with families. I really like working with patients and getting to know them and helping them when they had trouble. I looked forward to going to work every day. Before I went to work, I learned one of the official languages of Kenya, which is Swahili, and I had to go to language school for 4 months to learn how to speak it. So I am going to say something to you in Swahili right now, and that is, Wewe ni rafiki yangu. That means you are my friend.
You are my friend. So, why did you want to work with kids?
When I started medical school, I thought I wanted to be a family practice doctor because of my experience in the clinic in Nairobi. I liked seeing all the families. But once I was actually in medical school and I did my pediatric rotation, I really liked it the best. And I just like being around children. I like seeing newborn babies. I like talking to the parents. And I felt like I could be more effective maybe as a doctor if I went into pediatrics instead of family practice.
What does it take to become a doctor?
Well, if you want to be a doctor, you really have to like school. You have to like school a lot because you have to finish high school with a good report card every year. And then you have to go to college, and you also have to have a really good report card all 4 years. And then you have to go to medical school, and that is 4 more years.
Woo!
And then you become a doctor, but you still have to do your training. And that is like you decide you want to be a pediatrician, you want to work in urgent care, you want to be working in the emergency room, you want to be a bone doctor. You decide what you're going to specialize in. So that's additional training on top of all those other years.
What makes a good doctor?
A good doctor is someone who listens. A good doctor is someone who tries to see other points of view besides their own. A good doctor is someone who cares about their patients and is what we call conscientious. That means you do all of your work all the time. If you really want to help people, there are very few professions that give you the chance to do it, like medicine does. There's a wide array of things you can do. Like I said, you can work in an emergency room and really help people and save their lives. Or you can do what I do and kind of just work in a community and get to know people and help them.
Let's meet Lydia. She's a pediatric nurse practitioner.
My name's Lydia. I'm a pediatric nurse practitioner, and I've been working here at the Children's Clinic for 4 years now.
Why did you become a nurse practitioner?
I decided to become a nurse practitioner when I was already graduated as a nurse, so I guess I have to go backwards and say, why did I become a nurse, or how did I start to want to become a nurse? When I was growing up, one thing, I really liked science, and I also liked people. I liked interacting with people, and my mother always said that I was really good at not being grossed out by things.
Ew!
And so she always felt that I would make a really good nurse. So I volunteered in a hospital when I was in high school and got to see what nurses in the hospital do. And then when I started looking for colleges to go to, I decided that I wanted to become a nurse. Then I graduated from nursing school and I worked for a few years in a neonatal intensive care unit. That means I worked with babies who were born prematurely or who were born with defects and problems and needed to be in the hospital. And so I did that for a few years. And then after that, I decided that I wanted to go back to school for my master's degree to become a nurse practitioner. And I chose pediatrics because I like working with kids and I thought that it would be a good career for me.
How do you interact with your patients?
So on my typical day, I get to interact with patients by, I walk in the room and introduce myself, and then I say, why are you here today? Are you here because you're sick, or are you here because you need a checkup, or what can we do for you today? And so then if it's an older child, they'll tell me what their symptoms are or what's going on, and then the parent will tell me, especially if it's a baby or a toddler. And then after I get all that information, that's called taking a history. After I get the history or the information from the parent and the child, then I do an examination. And so that means that I use my stethoscope to listen to them breathe and listen to their heart beating, maybe listen to their stomach, and then I look in their eyes, ears, nose, and throat. You've probably had that done before with, we take the otoscope and look in the ears and the mouth.
What?
And so I'm gathering more information, kind of like an investigator, getting those clues to find out if what's wrong with them, or if it's just a healthy checkup, just to see, are they healthy? Does everything look good? Does everything look like the child is growing like they should and gaining weight and developing?
Are there other tests?
If the patient is here for a sick visit, then sometimes we want to gather more clues, and so we will do a test. We can do a test where my medical assistant comes in and does a swab in their throat. Maybe you've had that done before, and then we have a machine right here in our office where we can run a test to check to see, is it COVID, is it RSV, is it influenza, is it something else? So that helps give us what we call objective information, or one more clue to find out what is going on, maybe what's making this child sick.
Lydia, what do you like about your job?
Okay, so one of the things that I love about my job and about being a pediatric nurse practitioner is that I get to interact with children and young adults of all ages. In this role here in this clinic, I get to teach children, maybe a child who has asthma. I get to show them how to use their inhaler. I get to talk about what the triggers of asthma would be. I enjoy teaching parents about how to prevent obesity, ways that they could incorporate a healthier diet into their lifestyle and their child's lifestyle. So what I would say to someone who is thinking that they might be interested in becoming a nurse practitioner is I always tell people that it's helpful to at least enjoy science, like biological science, like learning about the body and learning about diseases and that kind of thing. Any kind of experience that you can get with working with kids, babies, so whether that's babysitting or volunteering at a after-school program or with the park district, that kind of thing would be very helpful as well. And just taking your school seriously, studying hard, trying to do the best that you can do, and reading is always a wonderful thing. So read books from the library about bodies, about science, about nursing, about children and development and that kind of thing.
Let's meet Angie. She's a medical assistant.
A medical assistant is a person that takes your vitals like temperature, blood pressure, respiratory rate, and height. We also administer vaccines. We draw blood. We make referrals and assist the doctor as much as possible. I believe that it takes a caring, loving, and playful person and someone that can make a child feel very comfortable in the exam rooms.
Why did you want to be a medical assistant?
I decided to become a medical assistant because I enjoy helping others and making sure that they're getting the proper care. To become a medical assistant, you have to go to school, study really hard, get good grades, and take a test, and then you can become certified.
Why do you like working with children?
I like working with children because I like to see them grow. They're very excited when they come in and they see they've grown like an inch or two and how much they've grown in the past year.
Am I still growing?
My favorite part of the job is building relationships with the families and patients, and letting them know that they can trust me.
What are kids most curious about?
Good question. I think kids are most curious about the instruments that we're using on them. So sometimes it's best to show them and explain to them how we're going to use them on them so that they're not afraid of that.
Let's meet our social worker, Yahaira.
Hi, I'm Yahaira. I'm the social worker here at the Children's Clinic.
What does a social worker do?
If you come see a social worker here at the clinic, what I do is I check how you're feeling, if you're having any problems, if you're feeling sad or worried.
Why did you become a social worker?
So I chose to be a social worker because I had a homework assignment. I had to review a teacher because that was what I wanted to be, a teacher. And then I saw a social worker go into one of these classrooms and I saw how they work specifically one student, and they were focusing on situations or how the student was feeling. And I looked more into it and I felt like it was something that I wanted to be, because growing up, I feel like I needed that extra help or somebody to listen to me or help me with my problems.
What does it take to be a good social worker?
I feel as a social worker, you have to have the compassion, have the heart, and you learn about yourself a lot and what you're able to do to help others. So it takes a lot of mind, so like what you like and what you're good at.
How do you help others at the Children's Clinic?
So here at the clinic, as a social worker, I work with the doctors, I work with the dentists, and we work on as a team of any problems or any situation that might be going on. Or sometimes the doctor or the dentist might come up to me and they might share something that they see in the visits, and then I reach out to the family and the child. So I like working at the Children's Clinic because we have the medical providers, we have the dental providers, we have different people with a lot of knowledge to bring to these families. So we're like a whole family itself to help these families that we work with.
How do you become a social worker?
So to become a social worker, you go to school for 4 years and then you volunteer after the 2 years and see what you like and what you want to work with. And then if you want to continue your education, you go for another 2 years to get your master's degree. So social workers are everywhere. You can find them at your doctor's office, schools, hospitals. They're just everywhere to help you.
We hope you had fun learning about all the different jobs in children's healthcare. We hope to see you soon. Come visit us.
Bye, kids. Thanks for watching. I hope you got some good ideas about jobs in medicine.